I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. So in this video, we are going to see about a case study which is going to present by Nandini, the third year from third year.
Hi guys, I'm Nandini and I'm from third year SNS College of Physiotherapy. So I went for clinical posting and I was able to analyze many patients, among who was Uma. She's 77 years old and she's a female. And the chief complaint that she told was she had right side shoulder pain along with the difficulty to lift her hands. So the problem list that she gave was she had cuff strain, tight adductors, and the limitation was there for her flexion movements. And when it comes to subjective examination, for present history, the onset was gradual and she had this problem for 2 to 3 months, and it was a radiating pain and the type was aching. So when it comes to a WAS scale, which is the pain scale, it was 6 out of 10, and the aggravating factor was lifting and reaching, and the relieving factor was when she was at rest. So when we come to objective examination, on observation we were able to see that her body build was fair and her posture was forward shoulder adaptation, and she had tight cuff muscles. On palpation, she had a biceps tendon which were very tender, and we did Neer's test, which is the patient should be in sitting or standing position, and doctor will stabilize the scapula, and the patient will have inward hand movement while the thumb is facing downward, and the doctor will do flexion movement. So in this, if she has any pain, it will be positive. So our patient was positive, and the sources of the problem was degenerative changes and capsular tightness, which can be diagnosed by X-rays. And the physiotherapy that we did for her were manual strengthening exercises and gun massage techniques for deltoid muscles, trapezius muscles, biceps and subscapularis. We did stretches for biceps and trapezius, and we did strengthening training using isometrics and progressive assisted exercises, and the modalities we used were TEDs. So followed up, we did functional tasks, and then we introduced her to exercises which included weight bearing. And then when it comes to skill development, specified for the skill that I developed, I learned to take pain assessments, and limitation in skill development, I was unable to follow up the complete cases, and when it comes to self-analysis, I learned to treat the pain cases. Thank you guys.
So Nandini from third year, during her clinical posting, she saw the case which is diagnosed as a condition as shoulder impingement syndrome. So shoulder impingement syndrome is nothing but due to the weakness of the rotator cuff muscle, the tendon of the deltoid muscle gets impinged in between the AC joint. So AC joint is nothing but the acromial clavicular joint. So this patient is diagnosed with which is having a gradual onset of pain. So gradual onset of pain is nothing but if a patient is having a chronic stage of pain, the pain rises gradually. So that's why she is mentioned here is an onset of pain is just and gradual. So in this condition, she suggested us at a radiating pain. So radiating pain is nothing but if a nerve is getting impinged at the joint level. So throughout the nerve course, there is a pain is getting radiated. So that's why she mentioned here is that patient is having a radiating pain. And then it is also mentioned as an aching pain. So aching pain is nothing but the dull aching pain. So dull aching pain is majorly seen in the condition who the patient is having any muscle imbalances or else muscle weakness. So these kind of patients may feel the dull aching type of pain. Then aggravating factor, if patient is lifting her shoulder or else gets to reaching an object in the higher level above the head level, the patient may feeling the pain. And relieving factor is nothing but when the patient leaves their joint in a rest state, she have a relieving factor. And then majorly on the observation, she mentioned that the muscle bulk is reduced, and as well as also the rotator cuff muscles are also gets tightened. So due to that, as a physiotherapy treatment for releasing the tightness of the muscle, the patient is prescribed to using the stretching for biceps and trapezius muscle, and as well as also massage gun. So massage gun is used among the patient to release the tightness in the muscle spindle of the deltoid trapezius, biceps and subscapularis muscle. Finally, there is a mention that the patient is prescribed for the modality is nothing but the TENS. So generally TENS is prescribed for which condition? For what? Treating what? So TENS is nothing but it is a modality which mainly helps in pain relief. So as well as the shoulder impingement syndrome patient already feels pain among the shoulder region. So reducing the pain level, so TENS is prescribed. So using TENS, the patient is helping to relieve or reducing the level of the pain. So thank you. That's all for this basic video. See you on next video.